Dubai Eye 103.8.
Helen Farmer with you. I've got a competition for you. I have got 1,000 dirhams for you to spend at Seoul Beach at JA The Resort. It is this gorgeous beach club. There's pool, there's sun lounges, there's pergolas, and yes, there's big screens because you'll be going along to watch the FIFA World Cup with 1,000 dirhams in your pocket. This is redeemable on entrance and food and drink for up to 4 people throughout the tournament. And every single fan that goes there can scan a QR code and have a chance of winning 1 million dirhams. You could be a double winner if you can tell me which country's flag this is. Today's flag consists of the colours red, gold and green in horizontal stripes with a 5-pointed black star in the centre of the gold stripe. If you know which country's flag that is, send in the name of that country and your name, 4001. Use the ARN Play app. You've got the WhatsApp too, and you'll be in the draw. 1,000 dirhams to spend at Seoul Beach.
Healthy habits.
On Afternoons with Helen Farmer.
Talking asthma on the show this afternoon, and who better to invite into the studio than Dr. Saeed Arshad Hussain, an experienced consultant respiratory physician, more than 3 decades of clinical experience. He's now here at King's College Hospital. And we're going to have a bit of a quick fire round on the text line, Doctor, if you don't mind. Yep. A really important question, and I'm so glad this came in, saying, do children really outgrow asthma, or does it lie underneath and creeps out later?
Yes, this is correct. People grow out of asthma. And this is also correct that people do develop in late age. So asthma could be a late onset. But children all the time grow out of it. And that is not unheard of. Or not.
Let's fingers crossed that's the case. No name on this message saying, what are the benefits of using a spacer, please? Does it really matter if we forget it when we travel? We've got a 4-year-old son who has the purple inhaler daily.
Yeah, I mean, there are quite a bit of a variety of inhalers available, but I think if somebody asked me my choice of inhaler, I would say I would use a L-shaped PMDI device, and I always advise it to be used with a spacer device.
What does a spacer do?
Yeah, so what a spacer does is the fine particles that are released from the inhaler. With the tidal flow of these particles, it gets deeper into the small airways. Because sometimes the problem is narrowing of the small airways, and to get the particles into the deepest part of the lung, deepest part of the airways is very important. Okay. And also it does away with any difficulty with coordination, because in some inhalers when you are not using with the spacer device, you have to coordinate with the timing of...
Yeah, that's right. Which is difficult for children as well.
So it is especially difficult for children, but some adults find it very difficult to coordinate. So I prefer that as my choice, to use with the inhalers, a spacer device, because it gets the particles deeper into the airways.
A message here saying, great timing. Hi both. We're beginning the asthma pathway with my 9-year-old, who's about 140 centimetres tall and 30 kilos. Peak flow is ranging from 200 to 230 pre-inhaler and can reach 250 to 300 after 20 minutes of inhaler use. I have no idea what's normal for him or other children. He's less breathless, very active child, but still coughing lots and struggling to recover from the cough. We're going back to the doctors in a week, but I'm just feeling a bit lost and clueless, so any friendly advice would be gratefully received. That's from Kiru.
Yeah, I have a confession to make that I'm not a pediatric doctor, so I do not see patients who are not adolescent age group. But from what the description is, I'm sure she needs to see a doctor with her child. And sometimes it's difficult to predict what a peak flow should be. So it varies from an individual to another individual.
So would you keep a diary then to see what's
normal? The peak flow meter
normal?
is a very, very useful piece of equipment. All it is that you're blowing into a hollow tube called the peak flow meter. When you blow into this hollow tube, it gives you certain readings, and that have to be jotted down morning and evening. And it produces a pattern. And what we are looking as doctors from this graph or pattern is a variability of the airway size. So it's measuring airways, and we're looking for variability of the airway size. If there's variability, it does suggest asthma. As I started my talk, asthma is a chronic but variable disease. Mm-hmm. So the size of the airways could change, and that is very nicely depicted on a peak flow meter chart. So I think a peak flow is a very useful thing. The child needs certainly to be seeing somebody with a pediatric pulmonology interest. I do see patients who are either adolescent or adult patients with asthma. But principle and treatment are similar.
Let's go to Leona, who says, I was diagnosed with mild asthma as a child. Now in my late 20s, I only take my blue inhaler when I'm ill. I've always just thought being short of breath is normal, so never expressed concerns to a doctor. Usually I sit down when it passes, but I'm now short of breath every day, whether it's walking upstairs, going on a walk. Sometimes it makes me feel dizzy, and I avoid exercise apart from walking as I can get into a right state with my breathing. Since last Saturday, I've been suffering with what I think is the flu. I've developed a dry cough and I'm so short of breath, even between the coughing fits. My blue inhaler isn't doing anything. What can I do to help? You need to go and see Dr. Saeed.
There's no doubt about it that you need to see me, but as a general rule, I must say because your topic that you brought out to the highlight is an important one. And a lot of people just hook on to the reliever inhaler, which I said earlier is the Ventolin inhaler. In the newer and global guidelines for asthma control, GINA guidelines we call them, they are now relying more on long-acting beta agonists with inhaled corticosteroid like formoterol. So we are suggesting other inhalers instead of the Ventolin. The reason is, as I said earlier, the tachycardia, the nausea, vomiting, the short effect of that inhaler, and it does not prevent things getting bad. So whenever people have to use more than 3 or 4 times a Ventolin inhaler, they ought to see a pulmonologist, and they would want to put them onto the right inhaler, which would be, as I explained, inhaled corticosteroid in combination with the long-acting beta agonist. We also use sometimes anticholinergic agents along with that, and leukotriene inhibiting tablets. So there are about 3 other treatments that can be helped, and you could have a symptom-free life. This is my message to everybody who's hearing today, Helen, that, asthma is not a disabling disease. It can be controlled very, very well. A lot of athletes have asthma and they're running for marathon. And you've seen one of my patients, she's participated in a recent marathon. So I think in today's day and age, there is no room for saying if you have asthma, you should have shortness of breath and cough and you should bear with it. No, we should have correct diagnosis and correct treatment with good quality of life.
We've got time for 2 last questions. One is from listener Dom, who's saying, how does the doctor feel about nebulizers in children? Because I'm hearing mixed reports. Interesting question. And then I've got a final question. Now, as I said to you off air, my daughter has asthma and we've had many a nebulizer experience. But when I've spoken to doctors, similar to Dom, I've heard kind of mixed reports. I've had friends from the UK who said, we've never seen a nebulizer in my life. Why would children get this? And then I've had people who've seen huge differences in terms of their child's lung health. What's your take on them?
Certainly, I'm talking from the adult perspective.
Yes.
On patient care, and in that I can tell you that in UAE I've seen a lot of nebulizers
Love
being
a
used
nebulizer.
compared to the experience I had in UK. Now I can understand that we have a higher amount of dust and pollution, and that probably causes a lot of people who asthma is not controlled. But I think there's an inner fear of people not using the inhalers, which are preventer inhalers. And I think this is a very important message, Helen, from this talk today to go out that, instead of relying on short-acting treatment, you should be having preventer treatment, which should prevent you symptoms requiring nebulizers. So I tell my patient that if I'm getting a good optimized care and treatment for you, you should not be using nebulizers. But nebulizers, on the other side, is a good treatment because it can do a bronchodilation and can help patient in a bad symptom situation. So symptom control can be helped. But as long as you can rely on the individual not to overuse the nebulizer, not to seek help, those kind of worries that clinicians carry, that if somebody is using nebulizer, they'll not come to the hospital. They'll not seek attention from a pulmonologist. And that is where it goes wrong. And deaths have been and mortality has been related to this. So I think this is very important, that nebulizers can be used, but it should not be required. It's like a backup situation. And now you go into a spare wheel drive when your car has a punctured tire, and you don't use the space. Yeah, you don't use the punctured tire, especially in a Korean car. They would make the tire which would not run. So you have to go to a workstation very quickly and get your tire changed.
It's a short, sharp fix. But if, as you say, if that condition's being properly managed by you in terms of your medication, but also those medications are being properly prescribed by the right physician, it shouldn't be needed. One last question for me, and we've only got a few seconds. For everyone listening today, in terms of overall lung health, is there anything we should or shouldn't be doing every single day?
It's a very, very important question. I can't be fitted into a few seconds, Helen.
Sorry.
But one message I must convey here, that smoking and asthma don't go match up at all. If somebody is smoking and they are going to have bad control of their asthma. So I think the important message is, apart from other things we talked about, that pets can have things in there, dust can cause it, but I think the smoking has a major effect on making things bad for asthmatics, and the inhalers don't work when you're using it. The cilia, the policeman, goes to sleep in your airways. So please, if you haven't made your decision before today, make your decision to quit smoking.
Dr. Saeed, thank you so much for your time. If we weren't able to get to your message, I apologise, but you can find Dr. Saeed Arshad Hussain there at King's College Hospital. And if you'd like his details, I'll be very happy to share them. Great to have you in the UAE, sir, and thank you for joining us.
It's a pleasure
this
there,
hour.
Helen. Thank you.
We will continue to talk health throughout the show. And don't forget, if you want doctor's details, by all means, drop me a line on 4001. We're heading over now to get the latest on your roads with Poonam.
This content is for informational purposes only. If you would like to seek medical treatment, please contact